So much, everyone, and thank you for your patience while we had this little technical problem, but now it's solved. So I wanted to thank you so much for your time. I am Dr. Elisa Praderi. I am the Clinical Protocols and KOL Manager at Formlabs, but I am also a trained clinician. I have a clinical experience in private practice and emergency service, and I have been with Formlabs since 2019. And today we're going to be talking about Formlabs Dental. So as many of you know already, maybe you are familiarized with Formlabs Dental at this stage, since it has been since 2019 already a very important vertical within the company. But just for you to remind, Formlabs Dental is a very special division within Formlabs that is composed by the dental business unit. We are a team of professionals that we have a lot of people trained in dentistry or with a lot of dental experience in the sales field, the marketing field. So we bring together that expertise in order to think of paths for development of materials, workflows, applications together that can be a solution to dental professionals. The other important thing is, of course, we have the Form 3B, a specific platform for printing biocompatible materials, not only dentistry, but also medical. Then we have, of course, a wide range of materials, which keeps growing and growing, and we will be seeing a couple of them in this webinar. And also, of course, preform, and we're going to touch base on scan to model also, which is the newest feature that we just launched a couple of weeks ago. So aside of that, it's also important to bear in mind that we have the dental service plan. And why is this important? Because dentistry has been one of the areas that in healthcare and in general that are having a great benefit with 3D printing. But it's very important for dental users that they have the right support. You will see now in the next slides that the level of expertise from clinicians, orthodontists, or dental labs is very different. And it's very important that there's a team that takes by the hand, for example, the users in order to have a good experience and be able to really get out the best of the 3D printing workflow and the digital dentistry workflow. So we work very extensively to develop this specific workflows, but also in our materials. We know that materials is the core of digital dentistry, and we work together and we validate to fine-tune and test these materials and test the print settings to know that we're getting the right result according to the demands of the industry, which are very, very high. And that's why it's important to have a team of professionals that validate this. We also are trusted by different dental industry leaders, as you will see some big names like DSD, 3Shape. So we work also together with partnerships that are from the educational perspective, from intraoral scanning to software, so we can provide a complete solution to the dental users. So one of the things that you might also have seen that Formlabs identifies from all the pool of dental dentistry and dental personas, we identify 3 subgroups and where we can start different types of conversations with these personas. So we divide the dental audiences in 3. We have the dental laboratories, we have the dental practices, and orthodontics. These 3 fields have, of course, a lot of similarities. We are working in dentistry. However, there are very important differences that you need to bear in mind. So maybe some of you are dedicated or to sell to dental personas or dental professionals, some of you not. But it's very important that all of us bear in mind what are the main differences and what are the main conversation points that we need to bear in mind in order to guide the user in the right way. And we know that we can let's say, provide a solution to their needs. So starting first with dental laboratories. So what is their business models? We know that the dental lab, this is exactly how it would look like. I'll share a couple of more pictures, but these are services that manufacture customized dental restoration and appliances. These are technical professionals in dentistry that they will receive cases from dentists, from clinicians, in order to produce an end part. These are trained dental technicians, and some of them can specialize, for example, in ceramics or in prosthodontics. But basically, they are trained clinicians. They never see a patient, and their work depends on getting, let's say, different jobs to be designed and produced by from dentists and to be produced by them. So their end customer, first things first, is the dentists. They usually have a network, and the word of mouth is very important for them. So they can, let's say, engage more dentists to send them print jobs to their own dental lab. So what is important for dental labs? What is their digital readiness? So it is historically known that dental labs are usually a step ahead in technology compared to the other dental professionals, for example, clinicians. They're probably already using milling machines and other types of technology in order to produce end parts. They are fast in adopting these workflows. They know what the technology is about because they have been using it longer than clinicians, for example, have been using it. So they already probably have a milling machine. They probably have some printers. They already have some experience in CAD software. So they are a step ahead. That's why you will get more tricky questions from dental labs compared to clinicians. And also, it's very important to know that, uh, of course, these are very highly trained technicians, which means that they have very good manual skills. And what they try to do is still some of them just to combine the analog workflow where they have this very good manual skills, but combined with the digital workflow. So they get a very nice part, but also benefiting from the advantages of the digital workflow. So what is important on their goals and motivation? They need to put out a high volume of quality work. They get a lot of jobs from clinicians, so they need to produce the part quickly, but also having the quality being consistent every time. So usually the owners of the dental labs, there's always a head of the dental lab, are constantly optimizing the labor and looking at to money saving solutions. So they're very always looking at their costs very closely. So that's why it's very important to know that, okay, how 3D printing can benefit from this aspect. So what do they value when they make a purchase decision? They will look, of course, to production of models. Of course, Formlabs has a lot of materials that allow to produce parts without the need of a model. But one important thing to know is that what is important here? The dental lab needs to deliver a part to a clinician, and the model is the patient's mouth that allows the dental lab to check that the part is actually fitting before sending it to the clinic back to be cemented, for example, a crown in a patient's mouth. That's why it's important for the dental labs. They will still print a model. They will still check that the restoration produced is good, and that when they send it back to the clinical practice, there are no failures there. Everything is really done very good. So that's why model production is still core in dental labs. They will also look at resolution, at speed. They will compare the workflow to the conventional workflow, also with milling. They will also look at how they can combine these analog and digital skills, and also how to integrate CAD softwares, but also how to integrate their workflows with the clinicians to be able to offer these digital solutions to them. So what does the dental lab look like? Usually looks like this. There are a lot of dental desks with the dental technicians having their own working station. There are a lot of job orders that come in. And usually there's a head of the dental lab, like dental technician in charge. As we see here in Germany, for example, you need to be a master dental technician to own a lab. This can vary according to country. And there also are some digital tools. So there's always a manual station. And for example, if they also have incorporated 3D printing or are looking to acquire, let's say, technology like a CAD station, so it will look some sort of this. So there will be like a CAD station. If they get the plaster model from a clinical practice, they can scan it. Then they do the setup in the CAD station, and then they can 3D print the part. So it will be a combination of this picture and the previous one. Now moving forward to dental practices, what is their business model? I think that this is pretty obvious to most of us because we're all dental patients. So we know that dentists see and treat patients. They're usually paid per appointment, and these can vary depending on what is the objective of that appointment, from 15 minutes to 2 hours. And of course, in the dental offices, some clinicians can work alone, or some can work associated with other clinicians, for example, an orthodontist, a prosthodontist, and different specialities associated, but it's not always the case. So what do they do, the dental practices? The treatment plans that they offer is, for example, implant placement. They check for any bruxism and temporomandibular disorders. This is a fancy word to mention that there are alterations in the articulation and people grind their teeth. And also they look at other sort of restorative cases. For example, if you need a crown, if you need a bridge, they also do that. So their end customer is pretty obvious. It's the patient. So here it's very important to understand because the objectives and the motivations will be different because also their end customer is different. So their digital readiness, and this is as the first difference that you will see with the dental lab, is that they're usually not very digital. A lot of clinicians will start asking, what is 3D printing? And the reason why is because clinicians still haven't been trained in digital workflows, still don't know what 3D printing is. Maybe we're more familiarized with milling machines, but not so much with 3D printing. And they always will look at what can I do or use 3D printing for in my chair side? What can I offer the patient maybe on the same day? What can I do within my practice with this printer? And another important thing is that they will try to delegate as much steps as possible to their dental assistants. We clinicians are paid per appointment, so we're paid to see patients. And each step of the way that we can delegate, whether they're scanning or they're printing, to our dental assistants, it will all be a plus. So it's very important to bear that in mind, that the ease of use is crucial for a dentist. So what are the goals and motivations? Dentists are highly trained and paid. They have a staff, for example, office managers, but they also are assistants, hygienists that all work to optimize the dentist time. So the clinical time, it's very, very important, and every minute counts. That's why as long as we can delegate steps of the workflow to the dental staff, that is a plus. The patient focus is, and safety is core, and the ease of use is crucial. So what is the motivation and purchase decision? It's what materials are compatible, what software integrations do I have, what is the benefits for the patient, the comfort, what is the ease of use and delegation, can I produce chairside, and what benefits of doing in-house do I have instead of delegating this to dental lab. So all of these are important points to bear in mind. And this is how it looks like, very straightforward. There is a dental patient, the dental practitioner, the dental assistant, and clinical tools. Orthodontics. So yes, these are orthodontics or orthodontists, which is the name of the specialist. They treat cases with malocclusion. This means that this word basically stands for when you have bite problems or misaligned teeth, and you use different devices to to realign the teeth and have a good bite. So the treatment plans are usually, for example, placing braces or clear aligners. And the appointments vary according to what needs to be done, but usually you have a first appointment to place the device or place the brackets, and then you have follow-up appointments to do some adjustments. So the first appointment is longer, and usually the follow-up are shorter. So the end customer, again, yes, is the patient. And usually they are already tech savvy or a little bit more technology familiarized with the technology compared to a dental practitioner. And the reason why is because orthodontists have been benefiting from, for example, clear aligners and this kind of technology since before. We know that, for example, looking at Invisalign or big manufacturers, this has become a treatment option long ago. So orthodontists started to get familiarized with 3D printing since a long time ago. And they're more willing to teach themselves to adopt maybe, okay, I want to produce my own clear aligners in-house. They're also willing to do that. So their goals and motivation is basically they rely on the relationships with general dentists for them to refer them cases for having orthodontic treatment. And usually they also try to balance providing a positive patient experience and treating a lot of patients at once. So an orthodontic practice is very busy, appointments of 15 minutes, maybe you have 4 patients in 1 hour. So what is the value or making a purchase decision is the speed and possibility of multiple models. If they're producing models for thermoforming appliances, they will have a very big volume production. About materials biocompatibility, ease of use and delegation is also still important. And of course, what is the advantage of producing this in-house comparing to outsource? So this is how it would look like. It's the same as the dental practice, but basically the clinician treating has a specialty in orthodontics. And just as a summary, I won't stop this, I won't get into details, but this is you can look at this presentation later. This is a summary of all the dental personas that you need to bear in mind. So the motivation, I highlighted it there because their motivation is your discussion point or the conversation point that you can have with your dental users. And these are really the motivations that they have when adopting the digital workflow with 3D printing. So what do you need to know about the workflow in general to speak to these audiences? So this is a study that is published I put the source here. First things first, we have the traditional workflow and the digital workflow. First thing that we notice, traditional workflow has far more steps compared to the digital workflow. And this basically translates in the following. The traditional workflow is more time consuming, is more labor intensive, needs very well trained, for example, specialists. It also contains, as we have a lot of steps, there are many possibilities of adding an error on those steps. The less amount of steps, there's less prone to adding an error. And really the result depends on the manual skills of the individual worker. And on the other hand, we have the digital workflow, which allows us to turn around the times. It's less amount of steps. It produces more reliability and really you can produce parts in a very reliable way, and it's less dependent on those manual skills. So really it allows you to, as we're going to see, to combine the steps according to the specialist needs and really to make adjustments and very easily in this case. So for the digital workflow, just so that you know, is that when you're having a conversation with a clinician or a dental lab, it's very important to know that there's no one way of doing things. You can combine different steps in order for providing different solutions. So for example, in a dental practice, you can have all the steps done in-house. So you have the patient, you scan the patient, you do the design in-house, and then you print and you deliver the treatment. That can be done in the dental practice. But there are a lot of clinicians that maybe don't want to adopt the CAD step because yes, it has a learning curve. Yes, there are a lot of costs, and really you don't have the time to dedicate yourself to really doing a restoration digitally. So you can delegate steps to the dental lab and still get the file back to print it in-house. So you can still benefit from 3D printing without having the need to purchase CAD software. And that's a very important note to bear in mind when talking to clinicians. But also for our dental lab customers, they need to know that they can also get the files and still do the digital workflow and manufacturing in their dental labs and then deliver back the finished restoration to the clinical practice. So there are different ways of combining this, and that's the beauty of the digital workflow. So what are other formats unique, like let's say highlights of our workflow? Of course, the remote printing, it's a very useful tool. It really gives a lot of flexibility to the workflow. You can design and upload the print job wherever you are. You just set up the printer and you're ready to go. So you just need to the dashboard and priming the printer. And this is very important because clinicians, once they're done and they go home, they can still do some of the work in their homes and send the print job remotely to the printer, and next day it's ready to be washed and post-processed. So it really makes the way to work very easy, and it even allows dental labs to send the file remotely to the printer of the clinician. So it really opens new possibilities of how dental labs and clinicians work together. Also, dashboard is very important because it allows us to really control what is printing and where, and it really allows us to have visibility of what's going on, even if we're not in the same physical space of our printer. And Preform. Preform, it's a very nice tool. It's very easy to use, and it's very loved by clinicians and dental labs. And it's very important to know that it's free of charge, and people love that also. So they can already start downloading Preform and even playing around with the model to see how easy it is to use. So it's free to install and really a very powerful tool that is very intuitive compared to other softwares out there. And aside of that, Preform has another very nice feature, which is Scan to Model, which is an excellent entry point for clinicians. And why? Because what we were talking about, CAD is the biggest barrier for adoption in 3D printing. So in 3D printing and the digital workflow. So really, if you can still produce models in-house, you can use Scan to Model. You don't need to purchase a CAD in order to produce models. And models is still, again, a core application in dentistry. So, sorry, what happened there? So what is important? So you scan the patient, you prepare the part, so which means that you add a base to that scan and you print it. It's just 3 steps. And what does that allow? It allows you to print basic model things. So for example, diagnostic models, models to do thermoformed appliances, and models for doing manual wax-ups. So for example, in the picture in the right is a perfect example of the combination of the manual skills, but still using a digital workflow. So you print the model, but you're still doing the manual wax-up with your skills. So advantages for example, adopting the Scan to Model is the same-day delivery. This is a very powerful concept that we're seeing in dentistry today, that you're able to deliver some appliances in the same appointment that you have the patient. So under an hour, you can produce the first aligner, the retainer, a bleaching tray, or for example, replace lost or broken appliances it helps in the patient engagement. That is very crucial. Patients that take away something in their first appointment have a tendency to come back for other treatments. So it integrates very, very well with all the workflow. And here I'm going to jump this, but this is a very nice testimonial from Dr. Scott Helly that he talks about his experience with Scan to Model. So I won't stop in there as we're short on time. And Form3BL, we know that we have another printer that allows us to sheet and present it also in the previous sector that allows you to print high volume production. It has 2 cartridges. It has a much bigger build platform and resin tank. And it's a very good point, especially for dental labs. And when do I select Form3B or Form3BL for dentistry? So basic macro view is that Form3B is for all dental professionals. You can print all the indications. You can do multiple prints a day, and it really allows you for small batches of production. So if I can print models and print indirect bonding trays, for example, in the same day in a very fast way, it's very easy to switch between applications. While the Form3BL, it's more suitable for orthodontic labs that have specific applications, for example, model production, surgical guides, and custom trays, for example. So it has minimal user interaction, so you run a big print and you just don't need, in comparison to the Form3B, so you don't need to be changing the build platform a lot of times. You usually leave it printing for a long period of time, and it allows you to print large batches at once. So from a production perspective, I leave you here some numbers, but you can see the differences in how much time it would take to print models flat on the build platform. For example, in draft resin, and as we see here in the left and in the right, how much time it takes and how much models you can fit, from 8 models in the Form3B to 24 models in the Form3BL. And also you can do vertical printing, which is something very interesting. And we won't get into much details of when to use this, but it is another option that you can offer to the dental labs or clinicians. So how to position the different materials? Now, this is another big sector. We know that there are a lot of materials in dentistry. We won't be looking at all of them today, otherwise it will take some time. But what I want you to understand is that another way of, let's say, driving the conversation is to focus, instead of a material, focus on the application that is going to be used. So for example, we divide the applications on orthodontic applications, and we see here that we have models for case presentation, mortar for clear aligner and retainer manufacturing, indirect bonding trays, and occlusal splints. These are materials that are used usually in an orthodontic treatment or for an orthodontic patient. And also, Formlabs has a material for each one of these applications. So this is a way that you can drive the conversation. And also, for example, to guide the conversation, then you can talk about materials being non-biocompatible and biocompatible, and you can take the conversation from there. Then we have restorative applications. This is a very big area that are both pertinent for dental practices and dental labs. So this is very good to know what applications will it be used in restorative dentistry and what material you can use in consequence. So just to give you a macro view, there are a lot of materials, for example, for model production and materials for biocompatible appliances. So important to note that, for example, for biocompatible appliances, we have surgical guide, dental T-clear, dentures. These are different materials used for different purposes. They have a registered intended use, as, for example, she had mentioned before. So they have a specific indication. And also we have custom tray materials, for example, temporary CB, permanent crown, and indirect bonding tray. So there are a lot of materials here that you can see that you can print biocompatible appliances. So now looking a little bit more into detail about draft resin, this material is very interesting for all dental personas. So draft resin allows you to print in 2 layer heights, 100 microns and 200 microns, which of course, depending on what you choose, it will affect the printing time. And here what is important to note is, compared to gray, which was the material that was used to recommend to print models, for example, for producing clear aligners, now you can offer draft resin, and you can see here that there's a significant difference in the time. So you can offer one model printed in 28 minutes. That means that you can offer a patient the same day delivery of appliances. This is very, very important to know. And for example, here's an experience of Dr. Jay Burton that he did his own comparison of gray versus draft generation 1, draft generation 2, and he started to produce same day appliances based on this material. For IBT resin for orthodontics, this is the newest material released by Formlabs that allows you to print in direct bonding trays. This means that you can design the tray in the software, you load the brackets, and you cement all the brackets at once in the patient's mouth, which means that this reduces clinical time. So it's a class 1 material printed in 100 microns, compatible with Form 2 and Form 3B. And what is important to know is that it really allows you to optimize a workflow. Instead of placing brackets one by one, now you can place all the brackets at once. And it really has a very good flexibility and optimized tear strength. And it has been tested with different light curing adhesives. So the bracket that goes cemented in the patient's mouth with different adhesives, we have tested it that the light passes and cures the adhesive to a tooth. And we have some clinical experiences from Dr. Elvitro, very worldwide recognized because of IBT workflows. And this is one of her clinical cases, and you can see how the appliance fits in the patient's mouth and it's being used. So it has very good optimal tear strength. And for productivity, you can see that you can print parts in, for example, in 44 minutes or in 1 hour, 36 minutes, depending on how many appliances you want to print. For custom tray, this is an application for dental labs and dental practices, more of a highly interest. And it's a class 1 material, it's biocompatible, and we have tested it also with different impression materials that you can use in the dental practice, like alginate or PBS. You don't need to know what these are, but just to know that to fill in this custom tray, you need an impression material to take to the patient's mouth, and we have tested it that it works with all of them. And these are the materials that we tested internally to check that the custom tray works with them. As for temporary CB and permanent crown, these are very noble materials that have different indications. So temporary CB allows you to print crowns, inlays, onlays, and veneers and bridges to be used up to 12 months. So this is very good to produce, for example, temporary restorations. When you are in a before getting the final crown, you get a temporary. And afterwards, when you're done, you can change to a permanent restoration. And you can use, for example, permanent crown. Permanent crown is good for single units, but it does not allow you to print bridges. And it can stay in the patient's mouth up to 12 months, and it's a permanent solution. And important to note that as part of our partnerships and working with other companies, these materials are the product of a collaboration with Vigo, and that we brought their materials to our printing platform, and we tested the settings in order to guarantee that we were getting good results with the material, and we have very nice user testimonials about it. So the similarities, they have the same, they come in the same shades, they require the stainless steel built platform, the post-processing is the same, and including the polishing, staining, and glazing. So the difference are in the indications and the amount of period that they can be in time, and the mechanical properties. So and the price, of course. So it's very important to know when people ask, what is the difference between temporary CB and permanent crown? You are going to be saying these differences. So the indications, the price, and how much they can be in the patient's mouth. But also it's very important for you to share this information, which are the mechanical properties. And here you can see that the water absorption, water solubility, flexural modulus, frictional strength are better for permanent compared to temporary CB. And this is very important, so you can mention this to the customer. So we also have scientific studies conducted by Vigo, because we know that permanent crown, people are very excited, but also may have some doubts. And these include some research studies that about breaking load and abrasion resistance, and where there was artificial aging and testing in universal testing machine to check that the mechanical properties are good and suitable after a period of artificial aging. Dental history and surgical guide. These are good for dental labs and practices. And this is also class 1 material, biocompatible, that can be autoclaved and available in 2-layer height settings. So this is a very nice material for implant placement, which can guarantee a very good positioning of the implant during surgery. And what's important to note, the differences, you see them here in the right of surgical guide. This is Formlabs manufactured. It has a 2% higher elongation than dental SG. A better flexural strength and flexural modulus. So this really allows you to have the material is an optimized version of the previous generation, and that it's a really nice solution for clinicians and dental labs. So your key takeaways is you need to know who your audience is, who is your persona, understand their needs, You also need to bear in mind that, of course, there are a lot of materials out there and important to adopt, but still model production is a core application in dentistry. We're going towards a modelless workflow, but we're still in the phase that we still need a model. The approach of materials should be based on application. The Form 3BL is suitable for dental labs more than dental clinicians, so offer this is better to dental labs. And that scan to model is a great feature for dental practices that are just getting started. So this is a very nice engagement tool that you can offer. So that's it from my side. I hope that I haven't bored you, but that it was more useful for you, and happy to answer any questions.